welcome to your cranial nerve examination. I'll be your junior consultant for this evening. If I can just confirm your name and address, please. Awesome. And now, what is the reason for your visit? Just a casual checkup. That is fine. Not to worry, it's better to be safe than sorry. So how many times have you had a cranial nerve exam recently then? You've had 437 in the last 4 years. Right. So you've had one every 3 days, give or take. Fair enough. I might make this a slightly more basic examination and remove a few of the obvious nerves. That is fine. So obviously you know what this is. We're testing nerves in your cranium. And now, are you allergic to latex? Okay, that is great. We will be using non-latex gloves then for this examination. Perfect. So, giving you a once over, you look relatively comfortable at rest, obviously a bit nervous because an unknown situation. You have good facial asymmetry. I can't see an issue there. Yep, your eyes are well aligned, they're looking clearly at me, and I can see you focusing and watching me move. That is fine. They also show no sign of ptosis or drooping, no sign of infection. And do you wear contacts or glasses regularly or to read? No? Good. And hearing aids, anything of the sort? No. Wonderful. That is great. Wonderful. So, some preliminary questions for you. Do you have any health issues to note of? No, nothing to note of. I would like to test your heart rate at a rest. It should be anywhere between 60 to 90 and I will not be concerned. Wow, that all sounds fine to me. Yes, well, your heart rate should be about 72, so that is fine. Now, do you smoke, drink, or do drugs recreational or otherwise? You drink, that is not to worry. Yes, everyone obviously has a nice drink now and then. It's not too bad for you. How much would you say? A week, let's say about a week. Right, so relatively moderation. That's great, not to worry. And your water intake daily, let's say water intake. About a litre of water. That's very good. No, yes, that's a lot better than some people. And the always interesting one, exercise. How much exercise do you get in a week? An hour? I mean, it's not excellent, but that's definitely, like I said, a lot better than some people that come through here. So on to the main examination now. As I said, it will be a slightly shorter one, as you have had so many, but I will ensure to give you a thorough seeing too. Now, as you probably will know, the first nerve is the olfactory nerve. That is to test your sense of smell, and it gives you also a sense of taste. If you noticed, if you can't have a blocked nose, your taste goes a little bit. So I'll be giving you probably 3 different smells in tubes, and I need you to tell me what they are. They can be pretty general, but if you get it spot on, I'll be very, very impressed. Let's go with this one first. Yes, can you give me a bit more detail? Not too shabby. That smell was pepper. How about this one? Give us something slightly different. Yes, that's quite a strong one, even I can smell that from here. This is in fact orange, yes, very good. And the final one, vanilla extract, very good. Well, that all seems excellent. Let me just... all very good. There's nothing seemingly wrong with your olfactory nerve, and I'm sure you've been told that plenty of times, so let's move on to your optic nerve, which is obviously for your sight. Pardon me. I'll be doing an ophthalmoscopy for this, and I'll be looking into the backs of your eyes. And I may just put some gloves on in case I need to touch you in any way. Because any reason or excuse to put a glove on makes sense to me. So yes, I'll be going first into your left eye, and then into your right. I need you to look left, right, and up and down for me when I tell you to do so. I'll be checking the back of your eye for any form of illnesses. Could even find some diabetes, but I doubt there'll be anything wrong with you as you've had so many tests. So, just a bit of a light in this. Yep, you can see that. Good. It shouldn't be too bright. Your pupils might constrict slightly, but it should be fine. Good. Now can you look left for me? Right. Up. And down. Great. That all seems fine. Now to your other eye. Good. Now left. Right. Up. And down. Well, that all looks completely fine, as is to be expected, really, with the amount of tests you have had. Great. Yep. That was nice and easy, nice and simple. Now I need to check your peripheral vision. I'll get somewhat into your centre. Now I need you to look right at my nose. I'm going to put my glasses back on for this, just so I can see you a little bit better. Because unfortunately my sight is not as good as yours. Lucky you. Yeah, so look directly. There's something strange next door. Now look directly at my nose, and I'm going to move my finger along your screen and tell me when it comes out of your sight. So keep straight at my nose, don't follow my finger at my nose. However, people in the past follow the finger, but I'm assuming that you've had so many that you don't need to be told that. So at my nose. Now tell me when it gets out of your sight. There. There. Almost can't reach that, jeez. Good peripheral. There. and there. Wonderful. Very good. I almost can't reach the extent to which you can see. Right, that is looking good. So that is both eyes. Now I want to do one eye individually. So can you cover your left eye? And I'm going to test your right eye in this case. So again, same kind of instance. Very good. I cannot see an issue with your right eye's peripheral, and I assume it will be the same for your left, but just to go over. So now can you cover up your right eye for me? Good. Good. Excellent. Wonderful. Very good. Yes, they're both fine. Yes, you can take your hand down now. That test is over. I want to also test your eye movements. So I'm going to, this time, move my finger across the screen. And you need to follow it, unlike last time. So, you can use both eyes for this. Good. That all seems normal. Your ocular motor is fine. What to do next? I think I'll make you cross-eyed next, because that always gives me a good laugh. So, you need to follow my finger as I bring it in closer and further away. Closer and further away. Closer and further away. Yep, always gives me a nice brighten to my day. That was absolutely fine. So now we need to, I'm going to put my finger here, and then you need to look at my finger and then at the wall just behind me there. And I want to see how your eye focuses and if there's any relaxation in your muscles. So yes, finger, wall, finger, wall, finger, wall, and a few more times, finger and the wall. Smashing, that was great. Nothing to worry about there. Again, this is a pretty procedure. I'm just going to take a light and see how your pupils dilate and constrict when light is present and when it is removed. It's quite bright, so I do apologise. If it causes any pain, let me know. Is that okay? Yeah? Smashing. Well, that all seems normal. Your pupils are dilating and constricting as expected. Yes, very good. Yes, good. Perfect. So I would normally do an eye examination with a chart, but it says here that you have one booked in the coming weeks. So I see no point in running through that. That is fine. Right, let's move on to the trigeminal nerve, shall we? Yes, we've covered quite a few already, but let's keep rolling. It's going very well, not surprisingly. Now I'm going to apply pressure here, here, and here. And now I need you to tell me, is it the same on each side? And I'll be feeling to make sure that it all feels relatively normal. Good. Right, let me know. And once more. Yep. Pressure feels the same. Good. And I need you to clench your jaw. So I can feel here. And in the temporal region just here. It should tighten, hopefully. Yep, that feels fine. Yes, your jawline feels good too. Very strong. Now, sticking around with your jaw, I need you to sway your jaw from side to side. Yes, you could say gun, but let's just ignore that one for now, shall we? So yes, that all seems fine. Yes, that seems perfectly adequate. Your trigeminal nerve seems fine. So let's move on to your facial nerves. Then we can all assume what that is. I will need you to pull some entertaining facial expressions for me. This is probably one of my favourite parts, so I'm glad that I get to do it. Now can you pull a big, nice, cheesy grin for me, just like that. Make sure you get your wrinkles up in here. I'm going to just feel these muscles here. That feels good. And now can I get you to raise your eyebrows and bring out some nice wrinkles in your forehead. Don't worry, everyone has them. That's why I wear my hair down, so no one can see my horrendous wrinkles at my age. So yeah, that seems okay. Yeah, we'll pass on the rest of the expressions, much to my disappointment. Now I'm going to need you to scrunch your eyes together, really tightly. I'm going to try and pull them apart, and don't let me. Good. And we're going to do this in with your mouth. Close it together, clench it tightly, and don't let me pull it down. Good, very strong jaw you have there. And now your cheeks. Puff them out and don't let me push them in. Good, that's excellent. All of those have been just fine. Right then, yes, we don't need to continue with your facial nerve. I'm sure you're going to be just fine, really. There's no need for a formative assessment. Vestibular contour. Yes, let's go on to your balance, orientation, and auditory functions, I think. So in this instance, I'm going to be going from ear to ear, and I'll whisper a number, and I need you to repeat that number back to me. And obviously, hopefully you'll be correct. Let me just move this out of the way. 13. So that was, yep, 13. 97. Yep, 97. 42. 42. 21. And yes, that was 21. As expected, that was all fine. quick test. Can I get you to tell me the 12 months of the year? Yep. Perfect, that is fine. And I'm going to move on to the trapezius muscles now, which are in your shoulders. I'm going to push them down, and I want you to stop me from pushing them down too hard. So hold them up and don't let me push them down. Ready? Good, nice and strong. I'm now going to do the same with your arms, so clench them tightly and don't let me pull them out. Good. And your other arm. Good, that's all fine. Now we'll do it the other way, so you push your arm out and don't let me push it in. Good, and now your other side. Very good. I'm now going to use my little hammer and just test the reaction in your arms. Let me take that out because they're noisy. So just a little hammer, not going to hurt one bit, but it's just to test the reactions in your elbow, and I'll work up my arm as well, up your arm as well, to make sure that it all feels the same the whole way along. Do let me know how it feels and if I am hurting you in any way. Yep. Right. So I'll start with your right arm. I'm going to work my way from your palm up towards your elbow. Yep. And back down again. Yep, and now for the same up. Good. And now I'm going to take your elbow and I'm going to give it a few whacks to make sure that your response is as to be expected. Wonderful. Same on your left arm. I'm going to work my way up from your elbow to your palm. Other way around, your palm to your elbow. And then I'm going to test your nerves in a second. That sounds good. And then I want to test your elbow. So yeah, just hold that there for me. Good. That looks great. Now I want to take your palm and I want to just take this little brush that came out of the hammer. I'm going to slide it along your palm to make sure that you have the right sensations in your hand. So I'll start with your right hand again. That all feels normal. Yep, you can tell what kind of instrument that would be. If I use the sharp one, can you tell the variation between the two? Good. And now your other hand. Yep, palm up. Thank you. And that feels normal? Good. And again, if I change it, can you feel the difference? Yep. Obviously, that one is much sharper. Let me just attach these back in. And this one. Wonderful. Yes, that's all very good. Now I mean there is others that we can do, but you're in perfect physical form. There's no need for me to press on with any more. Plus my hands are getting very sweaty in these non-breathable gloves. I do apologise if that grosses you out, but I like to tell the truth and I like to make people feel uncomfortable. So your report is perfect. Physical form. No illusion. Yep. I wouldn't recommend another exam for at least a year, but we all know that that won't be the case. I expect to see you in about 3 days probably, for another one. That makes sense. Yeah, you're fine. So you've got your eye exam coming up soon as well. That was performed by... Yep. And... Wonderful. That is all finished for you. It's been a pleasure performing one of your many exams. I do hope that you did enjoy this experience. It was very nice to meet you. Yes, thank you very much. Goodbye.